Hi everybody again, really nice to talk to you and thank you so much for being so positive about the last video. This time hopefully it'll be a bit more structured and useful for you. What I did this morning was I asked on the Breastfeeding Yummy Mummies Facebook group what people wished that they'd known before they started breastfeeding. Yeah, that they wanted to know. So I've got a lovely list, so this should hopefully help in terms of knowing where to go with this video. I've literally just gone through the comments and given even myself some pointers or written down kind of what that person said. Help you all wonderful ladies to have a successful journey with your feeding. I said this in the last video, I'm going to say it again, it's hard to breastfeed, but determination is the key, was the main thing that sort of came out from the comments from the people, and I would wholeheartedly agree with that, you have to be very, very determined to want to do it, because the easy option is the formula in terms of, you know, like relieving yourself by doing that, etc. But then you've got to deal with engorged breast and things like that, and yeah, all of those sort of wonderful things. So it is hard work at the beginning, but that little bit of hard work pays off pretty soon. I mean, it feels like a very long time at the beginning, and I remember when my son had colic, and the midwife or the health visitor said, oh, you know, when they reach 12 weeks, it will fade. There's like a random, the first 12 weeks are just go with the flow, really just go with the flow, because it's all a bit up in the air. Baby would really rather be still inside you. Look up the 4th trimester for that if you would like to know a bit more about that. So just stick with it for a bit. It will be pain-free at some point. So, you know, you're maybe talking a week or a couple of weeks, things like that. But obviously if you have toe curling pain and you're bleeding, or you have blisters on your nipples, really think about getting your child checked for tongue tie or lip tie, and going to a feeding clinic and letting somebody watch you feed. Your baby's latch on your breast is correct. Somebody said it will take over your life for a bit, but babies kind of do, and it's quite a shock when you're a first time mum, that you're aware that you're going to have a baby and then it's going to take up some of your time. I've got a really good example very recently. There's at my family centre I go to, there's a wonderful couple of 2 men who have gone through an adoption process, and they finally got their son, and he's wonderful. And the full-time dad, he said, I thought I didn't have free time before I had children. So that kind of like points out what it's like, that you may feel like you don't have free time, but when you have children it's a different kind of, like right now my son is asleep or trying to go to sleep, so this is my time, my sort of almost 2 hours of time during the middle of the day where I can really do what I want for a bit. That is dependent on if he wakes up as well. So yeah, it will take over your life for a bit. Let it. You will get your life back. I promise. I promise at some point you will get your lives back. But it isn't about us at the beginning. It's about keeping your baby alive and doing the best for them. Public feeding. Now, a lot of you will probably be very anxious about public feeding. Most of the women on this group had said to me that they wish that they hadn't been quite so anxious. I should have brought down, well, that might be in my hospital bag actually, but I have a nursing apron which has which you sort of put over your head, and it has it's a nice pretty pattern with like a rigid plastic sort of bit, so you can see your baby while you're feeding, and it generally covers you up, sort of, like, so you are covered like this. But obviously you are wearing a nursing apron, or you have a blanket over you, so that does actually sometimes make you more of like a target for somebody to look at, if you know, if you're worried about people looking at you. But what I found with public feeding was I got out and about very quickly because I was really determined to get out and about and not allow... I didn't want to be stuck in one place, and I did notice people did get stuck, like only being able to feed at home in a certain position, etc., and be very wary that you try and sit up and feed. Like, learn how to lie down and feed. I can show that somehow at some point. But while you learn that, make sure you also learn how to sit up and feed, so you can be out and about wherever you are, and you can stand up and feed, you can walk around and feed, you can have a baby in a carrier and you can feed them while you're going around the shop. It's fine. And most people don't notice you're feeding. That's the main point. The vicar, I'd gone to one of the groups that he was doing, and he started trying to like do the cross on my baby's head. And I was feeding, but he hadn't realised that I was feeding. So it is that, like, nobody really takes on board. And I mean, if they're lucky enough to notice that you're feeding, and they should really be supportive of you, and otherwise you don't. It's not worth you. It's not worth your time. You'll very rarely get a bad response from somebody, but it is natural, and I think, you know, off the top of my head, all I can think is, you know, I'd say to somebody, well, what does a baby cow drink? And they always do that as a joke, don't they? So that kids say, oh, water. But no, they drink milk from a cow. So what do baby humans drink? Human milk. That's usually, you know, that's a useful one. But it's very difficult when you get in conversations with formula feeding mums, because obviously they've got to the point where, you know, it really hasn't worked for them. Either I usually find it's because they haven't had a huge amount of support, which just breaks my heart, really. So public feeding is really, most people don't notice you're feeding, in all honesty. Okay, when they come out of you to begin with, their head is very small in comparison to your breast, but their head covers your nipple, and the nipple should be in the mouth most of the time. And if somebody's looking, that's their problem, not yours, if that makes sense. So I would go to coffee shops, tea rooms, things like that, go and have a coffee or a hot chocolate, whatever you prefer, and go and sit and feed. Enjoy that time where you can just sit and sit, because when they start moving around you do less sitting. Go with your partners, your husbands, and find other women who are breastfeeding as well and go and feed with them, because yeah, that was brilliant. I was the person that I would find people to feed with that were worried about feeding in public. So if you are somebody like me who is quite positive about feeding in public and wanting to give somebody that lease of life that they can leave their house, go and do that with them. Go for a coffee with them and feed your babies together, and enjoy it, because I mean, it's no different to bottle feeding in public, really, because both babies are being fed, and it is illegal to ask a breastfeeding mother to stop or move. That is the law in this country, in the UK, for those watching elsewhere. So yeah, bear that in mind, that yeah, it's fine. Public feeding is fine. I have fed in public. There you go. And you would work out ways when they're bigger, and if they move their head away, that, you know, like I would usually sort of hold my breast when my son was feeding, and should he sort of unlatch and have a look around because somebody's caught his eye or he's heard something, I would literally just do that over my breast. And I mean, there's plenty of magazine shots with women doing that, is there not? So there's no difference. And if you look at all the pictures of women actually these days that are for magazine shoots or like modelling shoots, there's a lot more flesh on display than breastfeeding mothers generally have. Get yourself breastfeeding tops should you wish. They can be a bit funny on sizing because apparently you breastfeed and are pregnant. Weird. There's never really like a nice tight fitting breastfeeding top. There's some really good companies out there you can get them from. Mums and Papas are really good, blah blah blah. That's where I've got some from this time. But last time I just had a vest top, and then I would put whatever top on over the top, and you lift the top up and the vest down, and your boob is there ready to be used. Eat and drink plenty. That's what somebody said. That get over to help getting over the tiredness. Make sure you do feed your body. We can all lose weight later on if we need to, or you may be one of those lucky ones that breastfeeding means that weight just drops off you. I find your weight. When I breastfeed, I put on more weight. So just go with the flow with that one. You know, this is going to be around, 2-4 years out of your life. It's nothing really. So go with it, accept it. Everybody else really should accept it as well around you, your partners and things. And yeah, just please keep yourself fueled with good things and some naughty things, because we're new mums and we deserve a treat. The sleepless nights don't last forever. You will be up in the night. There will be a small percentage of us that have those wonderful children that sleep through the night from 3 days or something like ridiculous like that. Babies don't usually sleep through the night until they're 2 years old, so don't get worried about a child not sleeping through the night until around the age of 2. That's when you can go, okay, no, we really need to look at what's going on and assess the situation and see if we can make it better. That's when you do that. You don't need to per se before then. Just ride with it. Some babies will refuse a bottle. So you may go, oh, I'm going to pump so my partner can help during the night. When you've reached the established feeding, which is around about 3 months. Established feeding is when it clicks all of a sudden, the feeding. So, you know, like when you learn to drive and all of a sudden gears just go, oh yeah, no, I've got it now. And the instructor doesn't have to keep telling you how to do it. That's what established feeding is sort of like. So you may pump and then you'll say, okay, I'm going to go out for an evening with my friends, and you'll get rung up and they'll say the baby's not taking the bottle, blah blah blah. That's normal. There are ways that you can introduce a bottle and things. Have a look on the kellymom.com website for that. I didn't ever introduce a bottle with my son. So yeah, I was always there for him. I didn't need to go out. I don't drink, so that kind of makes it possibly easier. And I have a few friends. I promise I have some friends. But yeah, so some babies do refuse bottles. So be prepared for that. Womb after pains following your birth, especially if it's your second or plus child. When you feed, it causes your womb to contract because your uterus needs to squeeze down, because obviously they're quite large at the moment. And they do squeeze down, but the feeding and the suckling on your breast actually activates that to happen, which, while is really good, they hurt a lot for some people, so do take pain relief should you need to. They're like, they do have a special name and I can't remember what it is now, I'm sorry. Constant newborn feeding is normal. They do feed constantly and for long periods of time. Be prepared for that. It is not that you don't have enough milk. I promise. I promise, I promise, I promise. Your body takes a while to catch up with the whole birth thing and producing enough milk and things. So the constant feeding from a newborn is normal, very normal, and they want to be with you. Again, if you decide to look up about the 4th trimester, it will click a bit more in terms of why they're with you constantly and constantly feel like they're constantly feeding. I mean, I would really suggest looking into getting some sort of wrap to wear, not to eat, to wear your baby with, Moby wrap or a stretchy wrap. A Moby wrap is a stretchy wrap. So you can sort of learn how to feed with the baby in the wrap. Learn how to eat one-handed, things like that. Trust me, you'll all eat one-handedly, because babies always wake up when you're eating your dinner. You can't give your baby to anyone else in the early days. You can, like, everybody takes them for a hug or whatever, but for feeding it is just you, and you really need to accept that that is the case and take it on board and roll with it. It's normal, that's how it should be, and yeah, really just accept it. It's difficult, but very much accept it. that you know, actually you don't need to go out. You're going to have plenty of years in the future where they can go to grandparents or friends or for a sleepover wherever, and then you have your time to yourself. But at the beginning, it's the hard work, but staying in and feeding your baby at night and things is kind of the only option to some mums. Well, it was to me, actually. Some babies take a bottle straight away and then it's not a problem. And then they get a bit funny, then they get nipple confusion. So you have to be aware of both of those, really. Get good breast pads, somebody said. I don't really have much, I don't use them, so I don't know very much about them. You can get reusable ones, which I think look really, really great. Especially if you're doing cloth nappies, because they all everything just goes in together. But somebody did say make sure you invest in some good ones. Growth spurts. I didn't mention this in the last one. There is an app for your phone that you can get called Wonder Weeks, and I think there's a book as well. Growth spurts are there for a reason. Every child goes through them. They all have them at slightly different times. There is a very well-known, or slightly unwell-known, I suppose, actually, but I'm very aware of it, and most people will become aware of it. Around 4 months, there is a 4-month growth spurt, and you all of a sudden think, like, your child starts sleeping more before then. You think, brilliant, cracked it, we're going really, really well, and then all of a sudden everything goes to pot, and sleeping goes weird, etc, etc, and it is a 4-month growth spurt. When you get through that 4-month growth spurt, it's sort of like plain sailing, if I'm honest. But like I always would say, if something was going really, really odd and really wrong, I would go, oh, probably a growth spurt. So yeah, growth spurts are mean little things, but you just ride through them, go with the flow, or like let it go, like they say in Frozen. You may hate breastfeeding occasionally. There is actually a feeding aversion, which means happens to some ladies. It's got a scientific name, that you have like a resentment, anxiety, sickness feeling whenever your baby feeds. You have to kind of flow with it. I think there are things you can do to improve it, and have a look on the Kelly Mum website for that. But there are times that you will hate feeding your child because you will just want to have some time to yourself for a moment. You'll think, I really need to go to the toilet, or I really, really wanted to watch this programme, or we really needed to go out and do something, and all of a sudden you're sitting and having to feed, or your baby's mucking around and on you and not feeding, and you're just, yeah, that can make it very, very difficult, and you can hate it, and that's fine. It is fine to hate breastfeeding. Obviously, if you're really, really hating it constantly, you need to work out why and try and address that and try and make it better. But be prepared to hate it occasionally. Sorry. Thrush. I talked about like tongue-tying things before. Thrush is a pretty nasty thing to have. Both of you can have it, or one of you can have it. It usually presents itself, you usually like have a lot of pain when you're feeding, so instead of tongue tie, sometimes it can be thrush. A visual sign is in their mouth, on their tongue. It is usually very, very white and covered on top, and they'll be pretty unhappy, and your nipples will hurt quite a lot. I was very lucky that I didn't get thrush, but it's very common. Given or you can demand a oral gel for your baby, and get yourself treated as well. You both need to be treated. That's very important, and some GPs don't realise that. Have a look on the Kelly Mum website for information about thrush. And it was very common, and actually it was also quite common for formula fed babies. It was all babies. I suppose if you've got a wet environment that's constantly got some sort of bacteria that's quite happy in there, that you've got a high chance of getting thrush. No routine for months and months, somebody put. Yeah, your routine, don't worry about a routine to begin with. Everything's a bit up in the air. They eat, sleep and poo eat, sleep and poo for for a good few weeks, and then all of a sudden they start like being awake for longer, and you go, oh, I've got to get used to this bit. So go with the flow of that one. Don't worry about getting into a routine. Don't think, oh, you know, I've read this book and it says that we need to be doing this, this, this and this. You know, feed your baby to sleep, it's fine, etc. I promise they do grow out of it. And yeah, don't worry about a routine too much. Self-weaning is not a myth. I am testament to that, because my son self-weaned himself. He decided he didn't want to feed anymore, and it is fine to allow your child to decide when they want to stop. That may mean that you feed for a good few years, and that's fine. It's not like they're not going to feed like a newborn when they're older, but they will still have you there, and they will have the comfort there and the milk, and why not? I mean, if the answer is, oh, because it's weird, then is it really weird? Why do we have to stop them doing something? Obviously, if it's not right for you and it's not working for the baby in you, then fine, change it. But you know, if it ain't broke, don't fix it, sort of thinking. Follow your instincts. If you have that funny urge to feed, offer a feed, because chances are your body's giving you a nice signal. So really go with your instincts on things. Once you have established your feeding, it's easy, pretty much. You get, you know, occasionally you'll have a hiccup and think, what on earth is going on? But no, it is pretty easy once you've got it established. You just got to get over that hurdle to begin with, and it's like the biggest hurdle you might have jumped. I've climbed Mount Kenya, and breastfeeding was harder. So that's what I always say, because of the endurance of it, really. So when your baby is fed and asleep, and you sort of realise that they're going to be asleep for a little bit, do take a bit of time for yourself at that point. Your partners hopefully should support you with that, and yeah, find those little things that you can do when you're near your baby, should they wake up or etc., that you can still get a satisfaction from, whether, you know, like watching a film, watching TV programs. I realise now that I have, in my time, in this time that my son is asleep, I will usually catch up on some programs, try and find some new programs to watch to learn about some new stuff, or do things like this. So yeah, use that time wisely so that you get some satisfaction out of it, or just sleep. Sleeping while your baby is sleeping is achievable most of the time, not all the time, and sometimes sometimes it's impossible. I always sort of try and, I've realised I still have to do it, teach myself now, is to clean my house as soon as they're asleep and laid down, clean, and try and like order what I'm gonna do and when, and I try and think ahead for that, and that means that I do it and it's done, and it's far easier to deal with, if that makes sense. And then I can have a rest afterwards. It's sort of like my achievement is a rest after I've done all my housework and my child is asleep. But don't overdo it, you know, with your housework. You know, your house is not the high priority. Your mental well-being, etc., and things like that are, and the cleanliness of your house to a certain extent is sort of second best once you've had a child. But I mean, just get pregnant again and then you'll clean your house like I have. There were some questions asked by some of you about inverted nipples or flat nipples. I actually have flat nipples pretty much, and feeding brought them out, which was actually quite uncomfortable because they're very sensitive. So there was like pros and cons to it. There are products out there that you can get, that's like, there's a small sucker that you can get that you can suck onto the nipple before you start feeding, that will draw it out. But from what I've read, it's called breastfeeding for a reason, because you mainly just get as much breast tissue into their mouth as possible. Nipple feeding isn't great. As the other video wanting to get all of the breast in the mouth. What is more important? So yeah, getting as much in as possible should help. Leaking nipples and nipples that have stopped leaking. Leaking nipples, brilliant, don't need to worry too much. Sorry if it's drowning your tops and things. It's amazing stuff, so it's good for your skin. And if you stop leaking, don't worry, your body will deal with it and sort it out. Or if you haven't like leaked at all, or if you've squeezed and there's nothing there, don't worry about it for now. It's all about hormones, and everybody's, I mean, some of it, I'm still being sick, I'm still on anti-sickness, and some of you are not feeling sick, so everybody's hormone levels are different, so that makes sense really in terms of the breast milk not being leaking out yet and things. You know, really don't worry about it. It will, if it's going to happen, it will happen when your baby is, when you're in labour, when your baby is born and things. And even then, you may still think there's not very much there at all, but there doesn't need to be very much. You know, you may not be able to be effective at getting it out of your breast. Somebody asked if they should take a breast pump to hospital, and I would say all hospitals do have breast pumps available. It's up to you if you want to use them or not. They do have hospital grade ones and demand to have one should you want to use one. But you have one at home ready for your partner to go and get it if you need to. I think maybe that's probably the best one, because we have to carry enough stuff in anyway. You know, use the hospital's appliances as much as possible to begin with. Yeah, so I think that's about it really. The main thing is support. Going and finding your support group, go and find your local breastfeeding cafe, breastfeeding workshop, and work out where it is, when it is, and who does it and things like that. And don't worry if your baby doesn't gain enough weight. Babies gain weight is good. It's when they lose weight consecutively over, you know, like 2 weeks that will be an issue. But your baby will lose weight to begin with, because that's what they're meant to do. And you're obviously producing cream if they don't lose weight. And enjoy it as much as you can. It's not easy, but it's not about, for me, it wasn't about me. I was determined to do it for my son, for my child, especially having had the birth experience I had. It was even more so important that I got that bit right, if that makes sense. So, yeah. Any other questions on that? Breastfeeding? Oh, I was going to say about, I hadn't brought up the other day, about supplemented feeding. There is a supplemented nursing system, and you can get it for, I think Medela do one, which you can either like put formula milk in, or your express breast milk, or if you've got donated breast milk, and it goes like a necklace around your neck. You fill it up, and it has two tubes coming out. So when you latch your baby on, you have the tube there, and then the tube is in their mouth sort of at the same time as you're having your breast in the mouth. So they're still breastfeeding and getting the milk from the supplemental nursing system. And that's brilliant. That's a really good way of sort of encouraging it and being able to breastfeed at the same time and things. And I've noticed, I usually see it with mums with premature babies, that it makes it much easier for them to have a feed, but also be learning to, you know, suckle as well, which is really beautiful. Should you end up pumping exclusively, you are still breastfeeding. Just because it's not literally, because the baby is not literally on your breast, doesn't mean it's not breastfeeding, if that makes sense, because you are still giving them breast milk. And if you see a mother with a bottle, you never know what's in it. So remember that. I always try and assume that it might be breast milk in there, and that, my goodness, she is pumping, and that's hard work. That's very hard work. So yeah, be supportive of each other and all those sort of things, and hopefully your journeys will be successful. Ask for help. Don't give up. You can relactate, but that's very difficult. You can also exclusively pump. I heard of somebody exclusively pumping for 6 months, and then she started breastfeeding, literally from the breast, with her child, and her child took to it like a duck to water, and it was quite wonderful that you can still do that. We're quite adaptable as humans, so that's a beautiful thing. And you will get your boobs back, and that's what boobs are for. That's what I can think of, really. I'm trying to think of all the things to tell you. Yes, but I will leave it at that, and I will do a cloth nappy video after this one. So there you go. Thank you very much, and if you have any other questions, please ask, and hopefully either I will answer or somebody else who's very helpful as well. So there you go. Bye bye.